Hello, everybody, and we're live. My name is Mark Nugent, live here with Colonel Greg Raths, who is going to give us an update of what's going on in the federal government over the last few days since we had talked. Good evening, Greg. How are you?
Hey, good evening. How you been, Mark?
Doing okay. Just tracking the numbers of what's going on and trying to figure out what's going on. And I've been working the last couple of days, so could you give us an update?
I've heard you've been very busy, trying to sell some masks, I understand.
Yeah.
Um, so far it's as you can tell, this virus is still lingering and still causing problems throughout the country and obviously throughout the world. Mission Viejo, we had our city council meeting last night, and several other cities in the county had their council meetings, and we're working as hard as we can to relieve the pain of some of the businesses and households around the city and the county. As you know, the current level, I believe it's around 68,000 here in the United States that are infected with the
I,
coronavirus,
I can pull it
and I
up.
believe,
I'll pull up the
and I
stat. I'll
and
pull
I
it up.
believe we went over 1,000 deaths. So this thing is
I will pull it
is
up, and I can give you the numbers real quick. The audience is looking at total
yeah,
globally confirmed 470,973. Total
right,
reported deaths 21,276. Total recovered 114. You know those
right.
numbers are not accurate when Spain has a higher death toll than China. We know China is not reporting; they're not testing, along with Russia as well. But I will pull up the U.S. numbers. So you're right. You're right on 1,031 dead in the United States.
Yeah, it's not receding at all. The epicenter remains New York City, and now it looks like Louisiana is starting a major breakout. So California, we feel pretty confident. It's not expanding as quick as we see in New York. In Louisiana, Orange County numbers are in for the day, and I believe it's 180 cases here, 187 cases here in Orange County, and the majority, which is interesting, 101 of those 187 are ages between 18 and 49. So it's not the elderly that is mostly you see in
Have,
other states like New York. So that's an interesting number.
have you heard of it mutating at all? Have you heard that? Any rumors?
From what?
Well, you said it because before other countries, from this is just anecdotal from what I heard in the news. It was old people. Then now you're saying it's young people. I'm just wondering if you heard anything that maybe it's mutated. I don't know. I'm not a doctor,
No,
so
what's happening is almost anybody can get it, but the death rate is higher among the elderly and the very, very young because the immune system of the very young have not developed, where the immune system of the elderly is starting to wane, and they may have other pre-existing conditions such as high blood pressure or diabetes or some type of lung disease from smoking or whatever, and those really have trouble surviving. So the survival rate, although our county showing 101 out of 187 are between 1849, I would assume from the numbers I've read in the last few weeks that most of those should recover uh, and continue on, and then they'll just carry the antibody. But right now, at the federal government, as probably most of your viewers have seen,
yeah.
is they're really working hard on a stimulus bill with the country pretty much shutting down. Everyone's taking a 15-day, uh, uh, pretty much a quarantine in place. That the economy is going to come to a screeching halt. And
Mm.
so what's happening is the Congress, Senate currently is working on a bill to stimulate the economy with $2 trillion. 100 billion of that will go to our hospitals to ensure they have the necessary equipment to take care of the sick, i.e., masks, i.e., gowns and shields and respirators and antibiotics and medication for those that are suffering. And 350 billion will be going to help small businesses. And the federal government looks at a small business as less than 500 workers. So they're looking to give loan guarantees to those businesses to help save their businesses until this epidemic or pandemic subsides. What we did here in Mission Viejo, we have restricted landlords from evicting businesses from their place of business through May 31st until they can get their feet back on the ground. And I saw Irvine did the same last
Yes.
night. I saw the mayor's comments. And also part of this is a extension of unemployment. It's usually 3 to 6 months, and I believe they're going to expand that out till this thing gets better. And also a cash payment to taxpayers of $1,200 per taxpayer if you made less than $90,000 a year, and then $500 per child. And they're trying to marry that up with the IRS. If you paid taxes in 2018, they're going to marry that up with your check to bank. Those that did not receive a return from the IRS via direct deposit to your account, they're going to have to find some way to mail the check. So that's probably going to be delayed. But right now, we're just, again, we're in the thick of it. And although one good thing, the FDA did approve today a blood plasma to help treat the COVID-19. So that's a good, and there's also 100 new different therapies being worked on for those that contract it.
Okay.
What I've done here in my city, Mission Viejo, I'm working two-pronged. I'm working with a manufacturer who makes swim gear and apparel for surfers, and he's going to change into making masks and gowns for the local hospitals. Okay. So I'm working on that myself. And then there's a company I've talked to today, and if all works out, they're going to have mobile units, and hopefully I can place them somewhere in our city or that our senior center parking lot or at the mall. They can actually take your test for COVID-19, not particular to see if you have it, but to see that you don't have it. And if you don't have it, this is a 24-hour, you get your return back in 24 hours, and you get a certificate that shows you do not have it. And then in 14 days later, you take another test. So this is what is going to be good for employers to say, if you're in a business where you don't have people coming in and out, and you have 10 employees that you need to work, you send them, they take this test, all 10 come back negative, they can all go back to work. So it's a whole different idea of finding out someone if they have it. Obviously, if one of the 10 has the virus, they can just stay home until they get better. But hopefully in 2 weeks, this is going to be up and running with 10 large mobile trucks that we can use within the county for employers. And I would like to see our city have all our employees tested. And so if they test negative, they can go back to work. So
I think that's definitely something we need, 100%.
Right. And this test is 24 hours. You get the results in 24 hours. And I just saw, I believe it was our congresswoman here in the 45th. She just got tested. It's been like 4 days and she doesn't have an answer. And you can't count on government programs to get you an answer. This is a private company, 24 hours, you get the results, you get a certificate, shows you don't have it, you go to work and show your employer, hey, I'm good to go, and then we all get back to work. So this thing's going to take off. And so I've been working with this company and trying to do what I can, and at my level as a councilman and as a city elected official to try to mitigate the problem of this virus. Instead of just sitting home for 14 days waiting to see if you have it, boom, get checked. I don't have it, go to work. So this whole idea is get people back to work.
Yeah, I keep hearing that you're doing really well. I mean, you're good. You're super healthy. So I'm glad to hear that.
No, I'm great. I feel great. Again, I've been staying home, but I sure like to know if I'm okay, so I can run over, say, to one of these mobile trucks. I get a quick check tomorrow. I'll know if I'm good to go. So the issues may occur with if you have people coming in and out all the time, say Disneyland, all the employees there, or they check negative, but then you got all these millions of people or thousands, hundreds of thousands of people coming in, and may not be effective for that.
Yep.
But this is for businesses that want to get back to work. And I'll give you an update as I progress. And this company is working with all the
So,
local labs here in Orange County.
and you said in 2 weeks it'll be up and running?
Yes, if not sooner.
That's great. And are you working? You said you work with the county as well. Is that correct? What you said?
Yeah, I work with the county level, basically just getting updates from Lisa Bartlett, who's our our supervisor here in the 5th District, which is South Orange County. She gives us an update every night. The city, we have our own website on cityofmissionviejo.org, and then there's coronavirus. It kind of gives people idea. Also, I wanted, if you go to my Facebook page on both Greg Raths and Greg Raths for Congress, Saddleback Church has set up pantries for those that need food, and they're located throughout the county. Lake Forest, Irvine, San Clemente, Corona, Anaheim, Laguna Woods, and Rancho Capistrano. And Saddleback Church has put these food pantries together for people who just need food. They can't afford it. Say that they've lost their job, but it's it's a pretty all these faith-based groups are really helping out. Now the City of Mission Viejo, we have a food pantry at our Murray Center for people who want to come by and pick up some food. So everyone's coming together. Although
Yeah.
it's a terrible, terrible pandemic, and so many people are sick, and so many people have died. It's also it's just so good to see people coming together and working as a society and as a community.
Oh, well, yeah. So, do you want to revisit anything? You mentioned some websites. I was trying to pull them up while you were talking. Did you want to talk about anything
Well, the
specifically?
City of Mission Viejo is cityofmissionviejo.org, and on the front page you will see coronavirus corona
If you
or
just
see COVID-19 information. City of Mission Viejo. I know the mayor of your city there in Irvine has the same on her webpage. I love. There is a coronavirus map that I always watch. Google actually has it. Crisis Response COVID-19 map,
okay.
and worldwide, as you said, 600 or 468,000 cases. So this is pretty significant. It started with one person, and one virus, and now it's spread to 500,000 people.
Yeah, I think it went
And
up while we
but
were talking.
yeah, I'm sure it has. But I just ask all your listeners and those that are listening live on Facebook that us electeds are doing as much as possible, and the city of Mission Viejo, the cities here in the county are working very, very hard, along with all our supervisors and up in Sacramento. So, if any good things come out of it, it can show how we can work together as a group. But it's interesting with this stimulus bill. I mean, I'm such a fiscal hawk, a conservative, and I running for Congress to really get the budget under control. And then with one whack, you're talking $2 to $4 trillion. It's almost hard to digest the amount of money to keep the economy going. And
Oh,
then obviously a lot of that is loans to companies that we can get back. But then again, a lot of it is just cash sent out to millions of people. And obviously they could put it back into the economy, but we'll put our country deeper, deeper in debt. But right now we have to realize the health of the nation is number one, and we can talk about the debt later. But it really bothered me the last 2 days how the Democrats have been throwing on all these um, crazy ideas, what they want to do. They see this big bushel of money instead of like, okay, it's for doctors, it's for hospitals, it's for gowns, it's for respirators, it's for people suffering. They're throwing in all these other things. Green New Deals, engines on airplanes by 2025. They want a certain level. They want $25 million for the Kennedy Center. And it's just not the right time.
I agree.
And I put up a post yesterday. I'm like, wasn't President Trump impeached because he was allegedly was not giving money he delayed money to Ukraine? They impeached them, and now we have the Democrats delaying money to American people and to American business. And the House, here's the thing, the House is not even in session. They're not even in Washington. They need to be in Washington to work on this bill. So where are our representatives? Again, I heard our representatives here in Irvine, and now she's sick, and there's no way she can get back to Washington to make the vote. So there's a way, if you're an elected representative at the federal level, you need to be in Washington, D.C.,
Well,
period. And
let's hope Katie gets better. I was kind of sad to hear about that today.
no, I saw her. She was on
Yeah.
the news tonight. Looks like she's going to be okay. It hasn't been determined whether or not she has it. She's just been having a fever.
Yeah,
But
it
yes,
could be
obviously
nothing.
we want her to be okay. She's. I have nothing against her personally. But I really think all our representatives and senators should be in Washington D.C. working on this issue.
Yeah, I
Period.
know
That's their job. They represent us, so
yeah,
they should not be here. They should be in Washington.
we did have two. I know at least two members of Congress and like five senators come up positive. So
No,
yeah,
I only heard one senator.
was it or was two
It was
like
Senator Rand Paul,
okay that was positive and the
and it was Klobuchar's husband who had it.
yeah
And I got
okay
heard today the
it was five
uh, self. Yeah,
self
they
quarantine. They
were
didn't something like that.
they were
Okay.
around somebody that had it. But I'm really working hard. I'm doing everything I can. I've been using all these new things like Zoom and Skype and all these other things I wasn't very up to speed with, but now I am. So, and my
Okay.
kids, my daughters are amazing. They're school teachers in Irvine, and as you know, all the schools are out, but so they're doing all the teaching via the internet and through using their home computers. And my daughters have been helping some of the more senior teachers that are really up to speed on the latest. So it looks like they pretty much got it all going.
Okay. Well, we know we're at 17 minutes now. We wanted to keep it at 15.
Okay.
So, do you want to any last words?
No, I just like to update the people. Everyone's doing a great job here in our community in Southern Orange County, where I deal with, and just keep up the good work. And I'll give you an update on this mobile testing that I'm working on with this company. And then also, a friend of mine's talking with Mission Hospital, Hoag Hospital, and Kaiser on what we can do to help them with making gowns or masks or visors and things like that. Right here in Mission Viejo, there's actually, I forgot to mention, there's a family that are making these gowns or these shields, and they were on TV today. I believe one of the local television stations, and they've been putting out 200 to 300 every few days to help with the local
Okay.
medical professionals. So far so good. Everyone's coming together.
Okay. Well, thank you, Greg. Appreciate you joining us. We'll check back in a couple days.
Okay, Mark,
Thank
and
you.
all the best to all your viewers. And I wish everybody the best. And if you're the type that pray, just continue to pray for our nation.
Thank you, Greg. Appreciate it. Take care.
Okay. All right. Bye bye.
Well, thank you for joining us. So we just want to do that quick federal update. If you have any questions, comment below somewhere in here and tag Greg. I'm sure he's very active. He'll get back to you right away and ask any questions you might have. What's going on in the federal government? I always appreciate Greg's updates. As I'm working every day from home, so I don't have the time to really dig into it like he does. Anyway, guys, join us again in a couple days. See who else we can have on to update us what's going on with everything. You guys take care.